Welcome to our presentation of the Creating Mentally Healthy Workplaces research study. In 2024, Construction Safety Nova Scotia commissioned WorkInsights to conduct the first ever comprehensive study of mental health in Nova Scotia's construction industry. Our study examined how workplace conditions impact the mental health of frontline construction workers in Nova Scotia, with special attention to the critical relationship between employees and their managers or supervisors. The critical findings from this study reveal how workplace conditions in our industry directly impact employees' mental health and well-being, and outline actionable strategies for fostering a healthier work environment. Our research engaged 1,171 employees across the Nova Scotia construction sector, representing diverse roles, company sizes, and specializations. This substantial sample allowed us to capture a comprehensive view of the industry's mental health landscape. The quality of our methodology is reflected in the standard deviation of 0.51, indicating high consistency in responses. With 67 questions covering various aspects of workplace experience, we developed a reliable data set that provides confident insights into the factors affecting mental health and construction. Our analysis identified 3 critical areas significantly impacting mental health in construction industry members. First, stress levels, with 36% of employees reporting high or very high stress. Next, managerial impact, with approximately 33% of workplace stress directly related to management interactions. Lastly, discrimination prevalence, with nearly 35% of workers perceiving discrimination, which correlates with an 83% higher likelihood of poor mental health. These findings represent the most significant opportunities for improving mental health in construction. By addressing these specific areas, reducing workplace stress, improving management relationships, and eliminating discrimination, companies can make substantial progress in creating healthier work environments while improving retention and productivity. Findings reveal a concerning disconnect in employee satisfaction. While the overall quality of work rating was 60%, which might appear moderately positive, a significant 47% of employees described their experience as unsatisfying and challenging. This represents nearly half of all workers struggling with their day-to-day experience. This gap between overall ratings and specific feedback highlights how surface-level satisfaction metrics can mask deeper workplace issues. This widespread dissatisfaction isn't just a morale concern. Persistent unhappiness, if unaddressed, can evolve into diagnosed conditions, while also driving higher turnover, increased absenteeism, and reduced productivity across the industry. Stress levels in the construction workplace are alarmingly high, with 46% of employees experiencing moderate to high stress in their daily work environment. Even more concerning, 36%, more than 1 in 3 employees, report their stress as highly intense, indicating persistent, severe pressure, rather than occasional moments of challenge. What makes this finding particularly noteworthy is that stress was experienced throughout the workforce with no significant demographic differentiators. It affects workers across all age groups, experience levels, and positions, making it a truly industry-wide challenge with substantial implications for both employees' well-being and business performance. The relationship between workplace stress and mental health is striking. Employees experiencing intense stress are twice as likely to report poor mental health. These highly stressed employees rated their work experience significantly more negatively, with an overall score of -4 on a scale from -5 to +5. This is compared to the workforce average of -1. This negative perception dramatically affects productivity and safety, as these employees spend mental and emotional energy managing their stress rather than focusing on their work. The data makes it clear: addressing workplace stress isn't just about employee well-being. It's essential for maintaining a productive, safe, and stable workforce. Our research identified the manager-employee relationship as the single most influential factor affecting workplace mental health, with approximately 33% of all workplace stress directly related to management interactions. The data shows employees with supportive managers report significantly lower stress levels and better mental health outcomes, creating a buffer against the inherent stresses of construction work. Conversely, when managers themselves are under significant stress, they're less able to support their teams effectively, creating a cascade effect of increased stress throughout their teams. This finding identifies a powerful leverage point for improving industry mental health. Focusing on manager training and support can positively impact the well-being of entire teams. One of our most troubling findings is that 35% of employees, more than 1/3 of our workforce, report experiencing discrimination or harassment. These employees are 83% more likely to report poor mental health compared to their colleagues, nearly doubling their risk of mental health issues. Employees experiencing discrimination rate all factors of stress 40% more negatively than the general workforce, and they are significantly less likely to feel comfortable discussing mental health concerns with colleagues. Addressing discrimination isn't just about compliance or workplace culture. It's a critical mental health intervention that can significantly improve outcomes for a substantial portion of our workforce. 26% of employees self-report regularly using alcohol and recreational drugs to cope with workplace stress. These employees are 157% more likely to report poor mental health, creating a dangerous cycle where substance use and poor mental health reinforce each other. Employees using substances to manage stress experience workplace stress with 33% higher intensity and are 33% more likely to be actively looking for new employment. This finding highlights an urgent need for better mental health resources and stress management tools to provide healthier alternatives for coping with workplace challenges. Next, we will look at the Nova Scotia construction industry's Net Promoter Score. This is a simple metric that measures employees' willingness to recommend their employer to others. This is calculated by subtracting the percentage of people unlikely to recommend their employer from those that are highly likely to recommend. With the Net Promoter Score, any grade above 0 is considered neutral, with scores of 20% and greater being considered favorable, and scores above 50% indicate a highly engaged workforce. Our industry's employee Net Promoter Score stands at 16%. While technically positive, it is only marginally above what's considered neutral. Even more concerning, 31% of workers would actively discourage others from joining the industry. The overall sentiment toward the working environment was rated at -1 on a scale from -5 to +5, confirming this slight negative trend. Together, these metrics tell us that while the construction industry has some dedicated advocates, we face significant challenges in creating environments where employees feel positive enough to recommend their workplace. In the face of challenges, the study also identified a strong foundation within Nova Scotia's construction workforce. 81% of workers find genuine purpose in their work, 85% of respondents clearly understand their job expectations, and 74% feel they are part of a cohesive team. These positive elements demonstrate that many workers are engaged with their work, providing a solid platform for employers to build and strengthen mental health supports that promote healthier, more resilient workplaces. A substantial 69% of employees directly link their financial stability to their mental health outcomes, meaning more than 2/3 of our workforce identifies money concerns as a major factor in their psychological well-being. This connection appeared repeatedly in comments with workers expressing how financial stress affects their ability to focus, their overall satisfaction, and their capacity to manage other workplace challenges. The data shows a clear call for improving compensation packages and benefits as a mental health intervention. This finding highlights an important opportunity for employers. Addressing compensation isn't just about retention and recruitment, it's a significant mental health investment that can reduce stress, improve well-being, and ultimately enhance productivity and safety. Our research revealed that communication gaps have a significant effect on mental health in the construction industry. 44% of employees report they don't feel they have a voice or are heard in their workplace, while 50% don't feel comfortable discussing mental health issues with colleagues. This creates a situation where workers suffer in silence, unable to seek support. This communication barrier perpetuates stigma and prevents early intervention. The data shows a substantial demand for cultural change, moving from environments where mental health is rarely discussed to ones where these conversations are normalized and encouraged. This shift requires leadership commitment, but offers significant benefits for both employee well-being and operational outcomes. Our study identified a significant gap in mental health resources for construction workers. When asked to rate current mental health benefits, employees gave an overall score of just 57%. Meanwhile, 52% give a failing rating when asked if coverage meets their needs and those of their families. This means most construction workers feel underserved by existing mental health supports. In open responses, employees consistently called for more accessible mental health resources, including easier access to therapists and more comprehensive healthcare coverage. Organizations that enhance their mental health resources can gain a competitive advantage in recruitment and retention while significantly improving workforce well-being and productivity. Our data shows a strong call from employees for better work-life balance in the construction industry. Workers specifically mentioned the need for more flexible scheduling options, shortened work weeks, and dedicated mental health days as practical solutions that would significantly reduce their work-related stress. This feedback highlights how the traditional rigid scheduling in construction contributes to employee stress and burnout. Organizations that can implement more flexible approaches to work scheduling may gain advantages in both employees' well-being and retention, as poor work-life balance was identified as one of the top 3 reasons employees consider leaving their current positions. Employees across all levels emphasized an urgent need for comprehensive mental health training and education. This isn't just about awareness. Workers are calling for practical skills to help them manage their own stress and support colleagues who may be struggling, to create a more psychologically safe environment for everyone. This training need must be addressed with measurable implementation objectives. Our data suggests that effective mental health training could significantly reduce stigma, which currently prevents 50% of employees from discussing mental health concerns. Organizations that invest in quality mental health education can expect improvements in both individual well-being and team dynamics. Our data points to 3 high-impact strategic recommendations that address the core challenges identified in this study. First, significantly enhance accessibility to therapy options, particularly through online platforms that reduce barriers of time, location, and stigma for construction workers needing mental health support. Second, develop comprehensive mental health training programs specifically for managers and supervisors, equipping them with practical skills to support their teams. Finally, ensure managers have adequate time and resources to implement what they've learned. With 45% of employees feeling their managers don't have time for people, this investment in managerial capacity is essential for meaningful improvement in workplace mental health. Construction Safety Nova Scotia is committed to helping our members take decisive actions to improve mental health in our workplace. Currently, we offer 2 courses with a focus on mental health first aid and psychological injury prevention. Mental health first aid empowers participants with the confidence needed to approach someone in need of mental health first aid while also seeking to reduce the stigma surrounding those who are suffering from a mental health crisis. Participants are equipped with the skills to administer care until appropriate professional help is received, or the mental health crisis is resolved. Psychological injury prevention helps managers, supervisors, and team leaders create and maintain psychologically safe workplaces by using simple leadership techniques that make a big impact. Participants will learn to spot and address unsafe situations, evaluate their current leadership methods, and take easy actions to build a psychologically safe workplace. This year, we will be launching 3 additional courses to help equip our members to support their teams. Occupational Mental Health, Opening the Door to Support and the Working Mind for the Trades. Occupational Mental Health is an e-learning course for all workers that teaches participants to identify the components of a psychologically healthy and safe workplace, how they can contribute, and when to seek support for mental health. Opening the Door to Support is an e-learning course for supervisors and leaders that teaches practical, on-the-job skills and tools for setting the tone for a healthy workplace, improving one's own mental health, and supporting the mental health of workers who are struggling. The Working Mind for the Trades is a day-long course for supervisors and leaders that teaches them how to create a culture of mental health awareness and support in their workplace. Participants learn strategies to foster a more resilient workplace. In addition to these new courses, we will be launching new toolbox talks and other resources. Subscribe to our newsletter and follow us on social media to be the first to find out when we launch these new programs. We have also partnered with Merit Nova Scotia to offer mental health services for small construction companies. Together, through the Green Shield Employee Assistance Program, we will provide members with access to 24/7 crisis support, mental health counseling, wellness coaching, and more. This service will launch later this year. Subscribe to our newsletter for the latest information. The insights from this study compel us to take clear actions to improve mental health in our workplaces. By implementing the recommended strategies, we can create more supportive, productive, and mentally healthy work environments. The path forward requires commitment from leadership at all levels. Let us commit to these changes for the well-being of the workers across our industry.